this is poster session number 3, and we have 4 studies. The first one by Dr. Laila Benzekri, Valacyclovir in medical and surgical treatment of segmental vitiligo. And we have Dr. Avina Jain, vitiligo or squamous cell carcinoma, which is more mentally distressing, and Dr. Reenu George, a cross-sectional study of clinico-epidemiological profile of childhood vitiligo, and lastly, Dr. Prakhar Srivastava, I'm sorry for the spelling, repigmentation in vitiligo universalis after starting anti-tubercular therapy. So let me start by our friend, Dr. Laila Benzekri. Laila, please, can you summarize your poster presentation? I liked it. I loved it, actually. It is very nice. It's a very nice approach. And please go ahead. Laila? So Laila?
Thank you very much. Hi, everybody.
Hi. So your study was on using Valacyclovir in treating segmental vitiligo, and you showed very impressive success rates for the Valacyclovir on segmental vitiligo. So are there any questions in the Q&A? If not, let me ask you, how recent did you start your Valacyclovir in segmental vitiligo? How short, when did you start it?
I start as soon as possible. You saw the first picture about a very early segmental vitiligo within 15 days of the onset of vitiligo, and with excellent repigmentation in 3 months. And we do not have any relapse after a follow-up of at least 3 years.
Oh yeah, yes, you showed it in your poster presentation. And did you use any phototherapy with Valacyclovir during this period?
The median.
Excuse me, I didn't hear it.
Yes.
You used it? You used narrowband UVB?
Nothing.
Just and the usual dose where we treat, how we treat the
Valacyclovir. Exactly. For 7 days only.
Yes, very impressive, actually. And
it's one therapy.
Did you didn't have any recurrences even with segmental vitiligo after treatment with surgically? The surgical treatment.
Oh, yes. Sorry, because I did not hear you. There is a bad connection.
Oh, sorry. You did not experience any recurrences with Valacyclovir, both with the medical and the surgical therapy, right?
No, I had 9 relapses, but 3 had mixed vitiligo, but just for monotherapy. But for surgical therapy combined with Valacyclovir, no recurrence, and very good repigmentation.
Yes, yes, it was very impressive. I saw the pictures. Thank you so much. It's an addition, actually. Yeah. Now, Dr. Avina Jain, she was presenting a poster about which is more mentally distressing to the people. Is it vitiligo or squamous cell carcinoma? So there are some questions here. These questions are for Dr. Laila Benzekri. So Dr. Wadad Mustafa, sorry, Dr. Jain, I will just finish with Dr. Laila and come to you. Dr. Wadad Mustafa is asking, did you find varicella zoster virus antibodies in such patients or any history of herpes zoster? Dr. Laila? Laila? Dr. Benzekri, this question is for you. Did you find Valacyclovir?
Yes.
Varicella zoster virus
Yes,
in the...
we found a very high rate of... Yes.
Yes. This was presented yesterday, actually, by Professor Reenu T. Yes. I saw the poster yesterday. It was nice. I
do not hear you.
You don't hear me? Do you all hear me, or you can't hear me?
We can hear you. Dr. Marwa, it's okay. I think the connection with Dr. Laila may be some issue. We can hear you, Dr. Marwa.
Okay, thank you. So there is another question. You can hear me now? Laila?
Yes.
Yes. One more question. Can I know what is the mechanism of Valacyclovir in segmental vitiligo? This was from Dr. Naveen Shawi. And let me say that they found varicella zoster virus in the tissue. And this was presented yesterday. And you can find it in the poster presentations by Professor Reenu T. Right? Yeah.
Yes.
These are all our questions. Now, let's move to the following poster. Thank you very much, Dr. Laila Benzekri. Dr. Avina Jain was presenting a poster about vitiligo or squamous cell carcinoma, which is more distressing. She presented a young lady, 24 years old, with vitiligo. She was not concerned about the and an ulcer, a really bad-looking ulcer on her leg of 10 years duration, right? And yes, she was not concerned about this ulcer, although it might be squamous cell carcinoma on top of lichen planus, and she was only concerned about the vitiligo, which shows the burden of vitiligo in females especially. In our countries, in India and Egypt, in skin of color people. So are there any questions to Dr. Jain? I have a question actually. You found out when you took a biopsy from the ulcer that it wasn't squamous cell carcinoma, that it was prurigo nodularis. Yeah. And,
yes, ma'am.
Yeah. And why did you suspect actually squamous cell carcinoma in such a young age and in a patient with vitiligo and skin of color? Skin of color is protective, and vitiligo is protective. And her young age. 3 factors that I wouldn't think in the first place that it is squamous cell carcinoma, although clinically it might be suspicious.
Yes,
why
did you... So, ma'am, basically clinically itself, because it was a very long-standing history, 10 years of an ulcerated nodular area and on the ankle site. So, we've seen squamous cell carcinoma even in skin of color. Definitely, I agree, not in a younger age bracket, but on old scars and old scars, we have seen SCC even in our population, especially over the lower leg area.
Yeah, thank you so much. Yeah. Thank you. Now, Dr. Reenu George from India is also showing a cross-sectional study of Clinico-Epidemiological profile of childhood vitiligo. Actually, did you find major differences in childhood vitiligo in your study?
Ma'am, we have not compared it with other study.
You're breaking.
But there are a few differences in between adults and children as compared. I'm sorry. We have not compared the profile of adult vitiligo with childhood vitiligo in our study. We have just studied the childhood vitiligo up to 18 years. And a few other studies have compared, and we have gone through that in our literature review, and there were definite differences, especially the prevalence of universal vitiligo. And yeah, so that was, it was not found in our study, even in 100 children. And also the association of autoimmune disorders, it was less prevalent in childhood vitiligo compared to adults. These are findings from other studies. We have not compared it in our study.
Okay, but the fact is that you took children from, let's say, 3 months old till 18 years old. That's a very big interval. So we did a previous study in our hospital, and we divided them into those less than 12 years old and those between 12 and 18 years old. We had actually a study which is published the beginning of 2021, and we compared childhood, adolescents, and adults, where the disease started first, and etc. And there was a difference between adolescents and young children. So did you find any such differences between adolescents and young children?
The segmental vitiligo was relatively more common in less than 12 years of age compared to 12 to 18 years of age. And also the associated autoimmune, the thyroid abnormalities, and we have found family history, all that were like 12 to 18 years of age, we have found all those. Mainly the segmental vitiligo part, there was a difference. And in our study, if you see, we have also divided our the study participants into 4 groups, that is 0 to 4, 4 to 8, 8 to 12, and 12 to 18. So overall, 12 to 18 was the most common age of onset. But when you see less than 12 years, it was 8 to 12 years, the most common age of onset.
Yeah, thank you very much. So we are going to add your study to the previous ones on childhood vitiligo, which was always intriguing. And in the past, they said that childhood vitiligo equals segmental vitiligo. This is no more true. We have this and that, and we have more non-segmental vitiligo in childhood than segmental vitiligo. Yeah, thank you so much. Now, the last poster is from Dr. Prakhar Srivastava, and he was talking about repigmentation in Vitiligo Universalis. It's a case report, actually. Repigmentation in Vitiligo Universalis after starting anti-tubercular therapy. Are they related or not? So is he here with us? Yeah, he's not. Okay, so he was talking about, let me just brief it. He was talking about a patient with non-segmental vitiligo, actually universalis, and it was stable for many, many years. He was 50-something years old, and when he started anti-tubercular therapy, the classic anti-tubercular therapy, INH, rifampicin, etc., he experienced repigmentation of his face, and this repigmentation remained all through the treatment with this treatment, and when he stopped the treatment, the repigmentation vanished. So it is interesting. The patient did not report any phototoxicity, although pyrazinamide is known to be phototoxic in some patients. And also he reported that interferon, that INH and rifampicin could induce hyperpigmentation. He's not here to ask him any further questions, and I can't see any questions in the Q&A or in the chat. So I think we should wrap up this session and thank all the participants in this session.